Madam Chairman. Thank you. My name is Ed Sparks. I'm the grandfather of a 6-year-old first grade boy. Since my last trip up here on the 20th, I've done my homework, and I have more concerns for this plan than I had a month ago. I am concerned about unanswered questions regarding the children's social, emotional, and behavioral plan. I'm also concerned about what the plan doesn't mention. One nagging, unanswered question which I have is who wrote the Senate Enrolled Act 529? Does anybody know? We haven't been able to find that anywhere. The plan mentions the word suicide and screening a combined total of 100 times, and it states that suicide is the third leading cause of death in children in Indiana. What the plan doesn't mention is the incredibly rare occurrence of these tragedies in Indiana. According to the Center for Disease Control, in 2003, the last year the statistics are available, there were 20 suicides out of 1.7 million Indiana children, 0 to 18 years of age. This is statistically an insignificant figure. The solution is certainly not to screen nearly 1.7 million Indiana kids, many of whom will wind up on psychiatric drugs that have a black box warning that says these drugs can cause suicidal ideation. What the plan doesn't mention is the report by a federal panel of independent experts called the U.S. Preventive Services Task Force, which says there is no evidence that screening for suicide risk reduces suicide attempts of mortality, and no studies were found that directly address the harms of screening and treatment for suicide risk. What the plan doesn't mention is what the chairman of that task force, Ned Cologne, has to say about suicide screening. He says, whether or not we like to admit it, there are no interventions that have no harms. There is weak evidence that screening can distinguish people who will commit suicide from those who will not. And screening inevitably leads to treating some people who do not need it. Such interventions have consequences beyond side effects from drugs or other treatments. Unnecessary care drives up the cost of insurance, causing some people to lose coverage altogether. The plan mentions psychiatrist David Shaffer, the inventor of a very controversial suicide screening program called TeenScreen. That's on page 54. What the plan doesn't mention is a recent study by Shaffer that says that kids who took their own lives were 15 times more likely to have been on antidepressants. That's 15 times more likely to have been on antidepressants. That's from the Archive of General Psychiatry, 2006. What the plan doesn't mention is the real epidemic in this country. The real epidemic is the over-medication of Indiana's children on psychiatric drugs. That's from newstarget.com, 9/27/05. The plan mentions exploring expansion for even more medication reimbursement for mental health services. That's on page 17, 18, and 31. Just one more minute. What the plan doesn't mention is that medical science has no biological or chemical test that can determine whether a person is depressed, suicidal, schizophrenic, or afflicted with another mental problem. There is no laboratory test that establishes. I have one more point to make. What the plan doesn't mention is that the $53 million Medicaid has already paid out.
You need to go.
Thank
Thank
you.
you. I
Okay.
appreciate it.
Thank you.
You're welcome.